Bleeding is escape of blood from blood vessels as a result of injury of these vessels. It is a life-threatening condition. It can lead to death and rescue to serious treatment. There are several types of hemorrhage according to the type of injury of the vessels. First of all, it's a perrexin, it's a mechanical damage, rupture or tear. Per-diabrosine, it's erosion of vessels due to necrosis, growth of tumors and the other cases. And per-diapedazine, due to defect of permeability of a vessel's wall. In these cases, we have an opportunity to see the other type of hemorrhage. In the picture in the right, we can see the capillary bleeding from injury of the fingers, and in the down picture we can see we have an opportunity to see the internal hemorrhage from bleeding ulcer in the stomach with growing of the blood in the hole of the stomach. According to a source of bleeding, we can classify bleeding like external bleeding when the blood flows outside. For instance, it's a wound of skin. The following one is internal bleeding when blood is accumulated into an enclosed cavity and space of body. Bleeding can be connected not only with trauma of injuring of vessels directly, but also it can start due to a high blood pressure and the other cases, and change of biochemical mechanism of blood. It's a coagulopathy, hemophilia, etc. Bleeding is classified as a primary bleeding when bleeding starts immediately after an injury, and secondary occurs if clot comes out of a vessel's, rise of blood pressure or a vascular spasm, and started some time later from injury, 2 or 3 weeks and more, in cases with rupture of yen and rupture of Hemorrhage. Bleeding can also be classified as according to a type of injuring vessels. We can classify it like arterial, venous, and capillary. The type of the capillary is a parenchymal bleeding. The main signs of arterial bleeding are massive and quick blood loss. Blood is crimson or scarlet, and pulsation of blood stream. The signs of venous bleeding: it's a massive blood loss, but there is no pulsation of the blood stream, and the color of the blood is dark like cherry. The signs of capillary bleeding: blood oozes slowly, often mild bleeding like dropping. The parenchymal bleeding is a special one. It's dangerous too, often massive, often there is no tendency to stop. Trauma with rupture of a spleen, liver, kidney, etc. The vessels of those organs have some peculiarities: short, without layers of muscles, and it is not spasmatic. That is the reason of continuing bleeding in these cases. Without medical care, patient died. We can classify hemorrhage according to a volume of blood which was lost. It's a degree of hemorrhage. We can classify the hemorrhage according to classification of American surgeon. First of all, it's a mild. Blood loss is not more than 10% of volume blood circulation. Moderate hemorrhage, blood loss is 10 to 20%. from volume blood circulation. Severe hemorrhage is a reduction in blood circulation volume according to 30%. And massive or profuse blood loss more than 30% of volume blood circulation. Clinical picture of the acute hemorrhage. First of all, it's a general signs of hemorrhage or acute anemia. First of all, it's a pale skin, dizziness, thirst, fainting, tachycardia, and hypotension. In heavy cases, even shock. The special things are melena, it's a black stools, it's a black color, ground coffee vomiting in cases of gastric hemorrhage or hemorrhage from the upper part of the gastroduodenal tract, the oozing blood from rectum or crimson, raspberry jam like stools in a patient with intestinal bleeding in the lower part of the gastroduodenal tract, especially its rectum or sigmoidum colon. In this picture, we can see classification of all general symptoms of high acute bleeding. We can see yellowing eyes, paleness condition of skin, respiratory shortness of breath, muscular weakness, change of stool color like a black, it's named melena if source of hemorrhage located in the upper part of the gastroduodenal tract, it's a stomach or duodenum, and stool like a crimson or strawberry jam if source of hemorrhage located in the lower part of gastrointestinal tract, rectum and sigmoidum. Central symptoms. It's a fatigue, it's a dizziness, it's a fainting, it's according to complication of blood circulation in the brain. It's a low blood pressure, it's a rapid heart rate like a tachycardia, chest pain, heart attack, and enlargement in the spleen. Very important is laboratory investigations, which give us an opportunity to estimate a type of hemorrhage and his degree. First of all, it's an analysis of blood, where we have an opportunity to investigate the level of hemoglobin, its red cells, a hematocrit. Special methods: X-ray, endoscopic and ultrasonic diagnosis. In cases with gastroduodenal bleeding, we provide endoscopic investigation. In these cases, we have an opportunity not only recognize the source of hemorrhage, but also provide methods of local endoscopic hemostasis for stop bleeding. The doctors must consider clinical, laboratory, and instrumental findings to each case to evaluate degrees of hemorrhage. This most known method of diagnosis is a normograph when considering hematocrit and weight of a patient and about blood density. Very important topic is a treatment of hemorrhage, because in the 21st century patient can't die from hemorrhage. We have to stop the hemorrhage. Hemorrhage must be stopped as soon as possible to prevent the shock and blood loss. You know that losing of more than 30% of volume blood circulation is a death hemorrhage. Symphysis is a very necessary thing in these cases. The management of bleeding has to be started with infusion of blood substances. It's a plasma, red blood cells, albumin, dextrans. But first of all, we can provide methods of hemostasis. Hemostasis is a universal method which we can provide in cases of in the accident place. Where can located accident place? Everywhere. At home, in the street, in the factory, in sport hall, everywhere. In very popular, very spreading and effective methods, it's the application of a tourniquet. Pressing vessels by fingers to bones in cases which injuring of the big vessels such as arteria carotis, arteria brachialis, arteria femoralis. Flexion of the limb in a joint in cases which venous bleeding. Wound package, tight application of a pressure bandage. We can see provide this method even in the accident place. It puts the forces of the vessel's clamps. We can see this type of pressure of the blood vessels to a bones by fingers in the picture in the left. In the picture in the right, we can see methods of stop bleeding by application special methods with using fibrinogen application. What according of tourniquet? Tourniquet must be applied not more than 4 hours in summer and not more than 1 hour in a winter. It is necessary to put a piece of the line of silk or a cotton tissue underneath the tourniquet. It should be applied firmly to 2 or 3 rounds, and the last one should be fixed to hooks. The best criteria of bleeding control is a correct application at disappearance on peripheral pulsation and stop of bleeding. If it is in arterial bleeding, the tourniquet is applied one of the place above the wound, and if it venous, underneath. The possible complication of using of tourniquet is ischemia or necrosis. In these cases, tourniquet should be periodically every 30 minutes released and weakened until the blood flow repairs. Blood in vessels are pressured only by fingers. The procedure can be 15-20 minutes, for it is difficult to keep on firmly. Vessels can be pressed in the place where arteries lie down superficially and near boards. Next method of hemorrhage control is a maximal bending flexion in a joint and bandage in the fixed position. It's provided in cases of venous hemorrhage. Wound package and pressure bandage, good for stopping capillary bleeding. This effect can be improved by application of an ice bag or a sand bag. It is enough to prevent intra-tissue bleeding and post-operative hematoma in cases of post-operative bleeding. We can classify the methods of hemostasis. First of all, it's a most spreading and effective. It's a mechanical hemostasis. It's a ligation of vessels or sewers or twists. Next type, it's a physical hemostasis, which provide according to a physical methods. It's a high or low temperature, high or low pressure, and using electrical or coagulation of the blood vessel. Chemical. This is a topic of systematic hemostatic therapy with using chemical substances like hydrogenium peroxide, which provide coagulation of the blood. And biological, with using of inhibitors of fibrinolysis, which provide by biological technology, and combined methods of hemostasis. First of all, it's necessary to find bleeding vessels and pick them up with a clamp and ligate them. They stop bleeding from small vessels. It must be enough to twist clamp around. The principles of it are in identification, isolation, and ligation of vessels. If the isolation is difficult, when the vessel is locked deeply in tissues, a surgeon should stir and ligate the vessels which surround soft tissue. There is special vessel stir in cases of foul rupture or large vessels. Traumatic needles are used in these cases or protease of the vessels. Physical methods. These methods are based on the effect of high or cold temperature with introduced protein coagulation and clot formation. We can provide this method especially in cases with local endoscopic hemostasis, where we have an opportunity not only coagulate the blood vessel, but introduce the coagulation of the vessels which surrounded by ulcerosis area, which provide strict clots in the vessels and create condition to stable endoscopical hemostasis. Chemical or biological methods are used when hemostasis can be resorptive or in cases of topical action. For example, plasma, latent mass, fibrinogen, Vicasol, dicinone, cryoprecipitate. These medical preparates create condition for increasing coagulation condition of the blood and create the stable clot in the vessels, which reduce risk of recurrence of hemorrhage. Topical hemostasis means usage of the fibrin sponge, anti-hemorrhage pack and swab, gelatin and hemostatic sponge. It can be used in cases when a parenchymal bleeding from the spleen and liver and kidney can't to be stopped by surgical classical procedures. These things should be applied on places where vessels are bleeding. Combined methods of bleeding control increase effectiveness of compression to separate usage. It includes glue to wrap around the sutures on the vessels, etc. Thank you very much, my friends, for your attention, and we are looking forward to your letters for your impression about this lecture and your questions, which we can answer with our pleasure. Thank you very much.